Namaskar. This is Dr. Alok Roy, and like every weekend, again, I'm here with you for some of the important topics in healthcare, which will keep you happy and healthy. And today's topic is very relevant topic. It was difficult to get clinicians to really respond to it because it's a very, very hard time for all physicians. But somehow I could get Dr. Roy ready to talk about dengue, do's and don'ts. Today, this is the dengue season, very rampant. The government says that 800 new cases every day and all that, but no one knows truly the right numbers. And we have hospital full of dengue patients. Most of the hospitals have dengue patients, dengue positive patients, many lives are lost. So I thought it was most appropriate to talk about dengue, and I have with me Dr. Aviral Roy. He is our senior consultant, critical care, senior consultant, medicine, and he deals with dengue patient day in and day out. So Dr. Roy, over to you to talk about dengue do's and don'ts.
Thank you, Dr. Roy. Yeah, actually, I just came from seeing a dengue patient just now admitted in the ER. So yes, a very, very high caseload. Give me 1 second while I upload my screen. Can everyone see my screen?
Yes, we can.
Excellent. Okay, give me one. Okay, everyone. Thank you so much for listening in. I am cognizant of the fact it is a Saturday evening for all of you, and I'll try my best to keep this as easy as possible. We'll start with the basics of dengue fever and what should you do and what all should you not do for the management of dengue. As Dr. Roy mentioned, I'm Aviral Roy. I'm a consultant in internal medicine and critical care at Medical Super Specialty Hospital. So what is dengue fever? We in India tend to pronounce dengue, but the actual presentation is dengue. It is a common viral illness spread by the bite of the Aedes aegypti mosquito and is very common in India and in other tropical countries. It spreads via the bite of a mosquito and it cannot be transmitted person to person. So while it is infectious, it is not infectious from person to person. Only mosquitoes can transfer it from one person to another. And if a mosquito bites an infected person, it can only infect another person after 10 to 14 days. What does this mean? It means suppose a mosquito is not infected and I have dengue and it bites me. It can only infect somebody with dengue after 14 days. But if a mosquito already has dengue virus inside it and it bites one person, it flies off and bites another person. Both those people will get dengue fever. Also, it is usually the second time somebody gets infected with dengue fever that dengue really becomes a more dangerous form, as we will discuss later, which is called dengue hemorrhagic fever and dengue shock syndrome that develop. The first episode of dengue is not so serious. Very often it just presents as a mild viral fever. We don't even realize anything about it. We don't do anything about it and we ignore it. And the second one that has a prolonged symptoms, the severe aches, the severe pain, the severe weakness, and the second time usually it causes more platelet count to drop. These are the risk areas of dengue fever. As you can see, dengue is a disease that is very common in the tropical areas. So as we can see over here, right, all of India and especially along the rainfall regions. So sub-Himalayan, entire Western Ghat, Eastern Ghats, the entire, Indo-Gangetic plain, what you call it. And so India actually has the highest burden of dengue fever in the world. As you can also see, some little bit in Thailand, Cambodia, Vietnam. Indonesia has a very, very high load. A lot of Africa, a lot of sub-Saharan Africa, and a lot of South America, especially Brazil, and a little bit in Mexico. In the United States, Puerto Rico tends to get a lot of dengue. I just spoke to a colleague of mine who was saying he first saw his first case of dengue from a lady in Puerto Rico. Anyways, moving on. What are your symptoms? So symptoms will usually start about 3 to 5 days after the mosquito has bitten you. So, by the time you realize that the mosquito is far gone and bitten far more people. That is why when dengue fever comes, it starts as a sudden epidemic. Most people, and you will very often hear people living in barracks, people living in hostels, multiple people have been affected. Why? Because the same mosquito goes around biting multiple people at the same time. What do you get? Sudden onset of fever, chills, which means you're feeling cold, rashes, flushing, which is redness, severe headache, commonly in the front, the eyes pain, especially pain behind the eyes. You get severe myalgia, which is muscle pain, especially backs, arms, leg, arthralgia, which is joint pain, general malaise, which means just feeling unwell, loss of appetite, abdominal pain, nausea, vomiting. This is because very often we are seeing dengue causes mild hepatitis. Lymphadenopathy means swollen lymph nodes. The reason this is, your lymph nodes are the main body immune system that fights dengue. It filters the dengue from your blood. So these are the areas where the war is being fought. If you're starting to get low platelet count, you can start to see a petechial rash, which basically means a bruising, easy bleeding under your skin. Sometimes you can see bleeding from the nose and from your gums, especially after bleeding. In most people, these are self-limiting and patient gets spontaneously better and without having to do anything. So just to go over, mild symptoms are headache, pain behind the eyes, a fever, a rash, some flu-like symptoms, meaning weakness, malaise, just feeling unwell, mild nausea, vomiting, joint and muscle pain. But when these progress to the more severe symptoms, how do we understand these? If they start having bleeding, vomiting, shock meaning low blood pressure, severe pain in the stomach, difficulties of the heart, lungs or liver, your blood pressure starting to drop, and easy bruising and of the skin, which means that the blood is starting to collect under your skin. These are symptoms of severe dengue fever. Severe dengue fever are of two types, what we call dengue hemorrhagic fever. Let us call this moderate. You have mild, which we discussed. This is what we call moderate. It is dengue fever which is progressing to become more serious. What is happening is the body's immune system is fighting the infection. And like we heard in COVID, what you call cytokine storm, this is a dengue cytokine storm. Basically, the body is trying to fight the dengue fever and starting to release all sorts of chemicals to fight it, which are causing more damage to the body than the dengue fever actually is. So you start developing what you call leakage, plasma leakage. So you get swelling of the arms, swelling of the legs, your urine output starts to drop off. Because the cytokine storm causes a sudden drop in platelets, you start having this bleeding, hemorrhage. You get GI bleeding, you might have a little bit of bleeding inside the stomach, inside the intestine, around your gums. Sometimes you see redness of the eyes, what we call subconjunctival bleeding. And in some people, they might see bleeding in urine due to very low platelet count. This is moderate, but this is very time sensitive. This has to be treated quickly rapidly with IV fluids and other, platelets and other supportive treatment. Otherwise, it might progress to dengue shock syndrome. What is dengue shock syndrome? Basically, you're losing blood and you're losing fluids. And if you're not able to replace this, do a blood transfusion, do platelet transfusion, give you IV fluids, what will happen is your organs start to get less food. So they stop working as well. We call this multi-organ dysfunction. How do you see this? In the kidneys, decreased urine output, increasing urea, increasing creatinine. If your liver is affected, you get confusion, you get disorientation, you get jaundice, bleeding increases, you get increasing nausea, vomiting, patient doesn't want to eat anything, they just refuse food. Because remember, all your food is digested and sent to liver. So if liver is under stress, the patient will not want to eat. Heart infection causes low blood pressure. You get something called dengue myocarditis, which basically means the heart pumping speed decreases or pumping power reduces. If it starts affecting the brain, you get confusions initially, But if you start having bleeding within the brain, you can get disorientation, loss of consciousness, and seizures. Lungs, you are leaking fluid in the lungs, so you get decreased oxygen level, increasing cough, difficulty breathing, and then towards the severe stage, it can cause what? ARDS. And then intestine, you get bleeding again in the intestine, so you might be vomiting blood, or you might be passing blood in your stools. You can get diarrhea. You can get swelling, not of the stomach, but of the entire abdomen, where the intestine basically stops moving. So gas starts to collect and food starts to collect inside the intestine. So this is dengue shock syndrome. How do you diagnose dengue? The diagnosis is very easy. I'm sure you have all heard of these. Dengue NS1, the dreaded NS1 positive. What is NS1? NS1 stands for non-structural protein 1. It is one of the proteins that are part of the dengue virus. So if dengue is circulating inside your system, we take a blood sample, we test it, and if this protein NS1 comes positive, it means you have dengue. It is usually present 24 to 48 hours after the onset of fever and lasts around 7 to 9 days. So if somebody gets tested less than 2 days or more than 9 days, he might have dengue, but they might test what's called false negative. If this happens and we as doctors are highly suspicious that patient has dengue, then we get something called IgM, which turns positive 5 days after onset and stays for about 14 days. Treatment is very simple. It is very straightforward for dengue fever. Symptomatic management. You have a headache, we give you paracetamol. You have body ache, we give you paracetamol. If you're vomiting, we will give you Zofar, Ondem, something like that to make you feel better. If you're having difficulty keeping fluids down, if you're not able to drink water, then we give you IV fluids. We are to avoid aspirin and other aspirin-like medicines, including Brufen, Meftal-Spaz, some of you take. Some of you will take Advil, lots of brands over there, like Decold. Avoid these medicines as they cause blood thinning, and then they can make you bleed easier. If you are concerned for your platelet levels, or you're concerned that you're starting to leak fluid internally, then we will admit you to the hospital and we will check your platelet count and hemoglobin concentration twice daily to see how your dehydration is doing. And if you need more fluid, if you need platelets, if you need hemoglobin, whatever you need to support your body systems. The other people might ask, what about other things like turmeric, fish oil? The trouble is a lot of these herbal and nutritional supplements, we do not know what's inside them. And some of them have blood thinning properties. So we usually recommend to avoid it unless you know exactly उसमें है क्या, what is inside it. तो हम उसको बता सकते हैं कि हाँ आप ले सकते हैं, हाँ मत लीजिए. There is some evidence that papaya leaf juice may help in increasing platelet count. In any case, there is no harm to taking papaya leaf juice. So we do not have a recommendation for or against it. You can take vitamin C, as there is some study that vitamin C may help improve platelet function. So we do recommend some vitamin C if patients are having low platelet count and some bleeding. In any case, there is no harm in taking vitamin C. Some common do's and don'ts. Always ensure you're wearing some amount of mosquito repellent in the rainy season and the monsoon season. In Calcutta, the monsoon season is roughly from pre-monsoon showers, so late May, early June onwards, till about end of Pujo, end of Diwali also. We will, and in some seasons we have seen dengue patients almost till Christmas. So till then, till there are mosquitoes, till you can see mosquitoes, wear insect repellent. Ensure there's no stagnant water, even puddles, pet bowls, flower pots, not plants, bins, containers, buckets left outside, gutters. They should not be standing water. Flowing water is okay. Standing water, try to get emptied, try to get covered. Contact the KMC and ensure that they get covered. Use mosquito nets and mosquito screens in your houses and your windows, in your house windows. If you do not have the ability to put a screen, ensure that your beds have nets. Some people use essential oils like eucalyptus, neem oil, lemon, tea tree. I'm sure all of you use diffusers for that fragrant smell in your house. Using oils made from these plants may help in being a natural mosquito repellent inside your house. Do not ignore any fever, especially in these conditions. You must have seen, along with dengue, we will see lots of other conditions such as malaria, chikungunya, scrub typhus, leptospirosis in this season. So if you're having a fever that does not have cough, cold, and you're not having diarrhea-like symptoms, it could be dengue, it could be malaria, chikungunya, scrub typhus. Talk to your doctor, healthcare professional immediately, get tested. Do not allow dehydration. Dehydration weakens your immune system. It weakens your response to virus. It also causes an increase in the virus particle concentration inside your blood. It puts increasing stress on your organ systems and can in fact cause severe dengue to develop more rapidly. Do not allow mosquitoes to breed. Drain all standing water in your house. If outside your house, remember, dengue doesn't necessarily have to come inside your house. Your surroundings included, including potholes, especially right now, it's been raining every day. Those potholes may not clear, and they become breeding grounds for mosquitoes. Any and all standing water in common areas that you yourself cannot control, please call KMC, Kolkata Municipal Corporation, if you live in Salt Lake, the Bidhan Nagar Municipal Corporation, to come and try to control it and to try to get rid of it. Thank you so much. If you have any questions, please let me know. Dr. Roy, back to you.
Thank you. Thank you, Dr. Roy. Dr. Aviral, I mean, why there's a cyclical pattern of this dengue? I've corrected myself, I'm not calling it dengue. I'm calling it dengue. So why this cyclical, every monsoon, why it comes? It's just because of mosquitoes, or is some more pattern, some more humidity, something else also contribute to the growth of mosquitoes?
Great question, sir. So what happens is, in the winter season, it's just too cold for the mosquitoes to breed. So they do not breed in the winter season. So that is why we will not see dengue in winter. Now, in the summer, not so much in Calcutta, but in other parts of India, it's too dry. There's no standing water left around. So that is why we do not see it at that time of the year. When do we see it? When it starts raining. Indian monsoons are unique. That's a tropical rain. So it is warm. So it is a perfect combination. There is standing water, there is warmth, and the standing water allows mosquitoes to breed. Now, historically, standing water used to be only in ponds and lakes. And all of these places have a lot of fish which eat the mosquito larvae. So that would historically keep the breeding in control. But now, with a lot of potholes, with a lot of plants and artificial water bodies that have no fish around them, there are no fish larvae available. There are no fish, baby fish available. These larvae now reproduce in an uncontrolled manner and result in a sudden massive increase in the population of mosquito, which need to eat and feed, and we are food. So what happens is there's a sudden increase in the number of mosquitoes, leading to a sudden rise in dengue cases.
That's also maybe the reason why the chikungunya, the dengue, the malaria, they all go up very high in this season. Is that so?
Absolutely correct. This, like, malaria is through Anopheles mosquito, which is again similar. Why you say daytime mosquito, you say nighttime mosquito, it doesn't really matter. All you need is one mosquito that does not follow the rules that we have laid down for it to go around biting people at the wrong time of the day. So it doesn't really matter daytime, nighttime. Most people don't even know when they get bitten. A. B. A lot of these mosquitoes will reproduce in very, very similar areas. And the same mosquito, that is Aedes aegypti, is responsible for dengue fever, is responsible for chikungunya fever. And if you go to parts of Africa, it's responsible for West Nile fever over there. So the mosquito is common. Mosquito is drinking blood at the end of the day.
Dr. Roy, this I was told that the fever, when it comes, that is not the time to worry. Time to worry when fever subsides. How much truth is in that?
So this is a true statement. So the reason for the decrease in the number of platelets when you have dengue is not actual direct effect of the dengue virus. What it is instead is your immune system clearing up the dengue virus. As the immune system starts to make antibodies to kill the dengue virus, it cross reacts with your own platelets. So some of those antibodies, instead of attacking the dengue virus, attacks the platelets in your body and clears the platelets. So in that process, your platelet count starts to drop. Now, if you have severe dengue fever, severe dengue fever can cause a direct depression of your bone marrow. So the factory is also shut, and you have increased destruction of whatever platelets are left. This is what causes severe dengue, hemorrhagic fever, and dengue shock syndrome.
So what is the gap between the platelets destruction and getting the fever, and how long fever lasts?
So like we said, fever will normally last between 5 to 7 to 10 days, 9 days, depending on your own immune system and how you're able to generate an immune response. Fever will also last depending on, is this your first episode of dengue fever or second episode of dengue fever? If it is a second episode, you already have some platelets. So while the fever might last for a shorter period of time, you will probably have a much larger drop in platelets. We normally see the platelet drop around 24 to 48 hours after the fever stops. So that is why in the hospital, if you're admitted for dengue fever, we will monitor you for at least 48 hours after the fever stops, because your platelet count might be normal, but it'll start to drop 1 or 2 days later. So if we discharge you too early, you will go home and then you'll have a low platelet count and you'll have to be readmitted. And you might lose valuable time.
Very well said, Dr. Roy. Dr. Roy, I have seen many dengue patients, their platelet drops from whatever it is to 30,000, 40,000, and there's no bleeding symptoms. But you all don't seem to be very disturbed. You wait for it to go down and it suddenly starts coming up on its own, and then patient becomes better and goes home without any intervention from you. What is that?
So great question, sir. The good news is when you start dropping your platelets also become more efficient and they become activated. So even though your platelet count drops to 20,000, 30,000, the likelihood of bleeding really does not go up unless it drops to less than 10,000. Yes, there are a certain subset of patients who have increased risk of bleeding, like hemophilia, if they already have known platelet dysfunction, if they take drugs like aspirin, Diplat, which is clopidogrel, blood thinners, acetrom, warfarin, where we are trying to make their blood thin. In those patients, we try to keep it higher, maybe 50,000. But otherwise, in most patients, we are not too concerned unless the platelet count drops to less than 20,000.
Interesting. So you have brought factor wherever we use blood thinners, in cardiac patients, in neuro patients, wherever we use blood thinners, those patients have to be worried about, and you will be alert if the platelet count goes below 50,000. In normal population, in younger population, it will not discriminate. You will wait for symptoms to appear because you feel that they on their own get back to the normal platelet levels. Is that a true statement?
Absolutely correct, sir. So normally we will not transfuse platelets unless the count is less than 20,000. In the rare case, if somebody's count is dropping very rapidly, like 150,000, then 80, and then 30, we might transfuse early because we are afraid by the time we check again, it'll be lower than our threshold. But otherwise, we will not transfuse unless you're below 20,000. And in some cases, especially in young, very healthy people, we might even wait up to 10,000.
Dr. Roy, there's a huge fear psychosis with dengue associated. What would you like to say about that?
So dengue is important. There is no doubt about it. But is there a reason to be scared? Not really. The likelihood of you getting what we call moderate to severe dengue fever, as dengue hemorrhagic fever, and dengue shock is less than 1% of all people getting dengue, right? Like with anything, I'm sure a lot of you have been in our COVID lectures. If you are elderly, if you have comorbidities, if you have like hypertension, diabetes, you take medicines which suppress your immune system, you're a cancer patient on chemotherapy, you are at higher risk. But that being said, then we have enough supportive mechanisms to take good care of you. The treatment is easy, it is very straightforward, and with a lot of government intervention and a lot of government action, the treatment of dengue is very standardized now, and almost every hospital can take care of patients with dengue. Again, the important thing is early recognition so that you can be closely monitored. And if you're closely monitored, the likelihood that you're going to have severe dengue or have bad disease or have severe disease is very, very low.
Very good. Thank you, Dr. Roy. I think all of us will agree that you have done a good job of explaining it properly. And I hope our listeners are happy to hear about dengue. And with this, we come to the end of this webinar. I'm extremely thankful to Bengal Chamber of Commerce and Industries for supporting us and Rotary Club of Calcutta, Vienna. If you have any questions, do write to us and we will certainly get back to you. And we will be present again next week with a new topic. Thank you very much. Have a nice weekend. Namaskar. Thank you, Dr. Roy. Thank you very much. Thank you.